Unreported child deaths, particularly in rural areas, make it hugely challenging to accurately measure the impact of medical interventions on child mortality in South Africa. This emerged at the Child Health Priorities Conference attended by industry professionals as well as academics at Potchefstroom in the Northwest Province. Dr. McKerrow says 1 in 4 children dies between birth and the age of 5. He says more needs to be done to improve data collection and the fight against infant mortality. Our reporter, Sentleng Lihihi, is attending the conference for us.
It's the second day of the Child Health Priorities Conference here at the Northwest University's Potchefstroom campus in the Northwest. We've seen in the past couple of days many speakers speak about issues that are relating to child health, talking about malnutrition, talking about all the developmental needs that need to be acquired as a child progresses in life to ensure that they stand a standing chance in society. But more so, we've also spoken at length about mortality among our children and what those statistics really represent. But for more details on the statistics of child mortality, I'm joined by Dr. McKerrow. Dr. McKerrow, just explain to us your statistical analysis of child mortality in the country.
At the moment, we appreciate that about 30 to 32, depending on your data source, children under the age of 5 will die for every 1,000 children will die before they reach the age of 5 years.
Now, one of the things that you spoke about quite pointedly there is that even if we've got this data analysis, there's still some discrepancies in all the different data collectors.
Okay. Our primary source of data is vital registration, and the reason is children die in the health service, children die in the community. So if you use a data source that depends on hospitals, whether we're talking public or private, we're not going to capture deaths in the community. Deaths in the community need to be reported, and the usual route for reporting is through the Department of Home Affairs. So they will notify their local leadership. Leadership will fill in documents that go to Home Affairs. Home Affairs collects the information and sends it through to Statistics South Africa. And if we take the data from hospitals, the data from the community, and aggregate all of that and compare data sets, what we find is about 1 in 5 children who die before the age of 5, death will go unreported. Some of those deaths are in the hospitals, some of those deaths are in the community. And the balance, the remaining 4 out of 5 deaths, half of them occur in hospitals, half of them in the community. Now, the community death unreporting is easy to understand. Children die. They don't report because the family are not going through a funeral parlor or an undertaker to bury the body. They may bury the baby in their own property, in a rural area, in the garden. And for that, you don't need a burial order. But in the cities, to bury a baby, you need to go through an undertaker to get a burial order in order to bury the baby in the cemetery. So for us, it's a little bit difficult to understand what is happening to deaths in the hospital that are not being reported. But that's about 1 in 5 of all children's deaths are unreported, unrecorded. And it's taken quite a long time to get a handle on those figures to try and work out what is going on. Now that we're beginning to understand, we can begin to improve our data systems and then the analysis of deaths.
Thank you for your time, Dr. McKerrow. What Dr. McKerrow is talking about there is the harsh reality that many of us struggle to deal with, the reporting of child deaths and the statistics around there. But for another reality that faces many of us South Africans is what happens to a child when they're stillborn. Let us now be joined by Sonja. Sonja is actually running one of the funeral parlors around here. Just tell us about the harsh reality when we speak about what happens to a child stillborn.
Yes, there's a difference between a stillbirth and a miscarriage. If you lose your little one prior to 26 weeks of gestation, it's referred to as a miscarriage. And after 26 weeks in utero, it is called a stillbirth if the little one is born asleep. So at the moment in South Africa, you may not elect to bury what you already perceive as your baby if this little one passed away before 26 weeks as a miscarriage. You must bury or cremate after 26 weeks.
This has created quite a harsh situation for, parents who have gone through this experience. Some of them do not have, the opportunity to lay their infant to rest.
Yes, that is so true, which is why I'm involved in a constitutional challenge at the moment in order to fight for the rights of parents. These bereaved parents, by not having the right to bury, is an infringement of your basic human rights, the right to privacy, the right to equality, and the right to dignity in terms of our constitution.
We look forward to seeing how your court case pans out, and thank you very much for your time, Sonja. It is clear from the sentiments shared by Sonja there that the rights of children are yet to be expanded in true reality. We'll still see more deliberation around child health issues as this conference continues. For now, back to you in studio.